It's really important for us that the local service board has adopted this demonstrator site as one of its main priorities for action. Having a senior leadership team being motivated and involved and helping to create a shared vision of services and being vocal and visible about that has made a real difference. Locality teams have been a key component of the demonstrator site. Across Gwynedd, we have worked with local government and the voluntary sector to identify the boundaries of those localities, boundaries in terms of geographical boundaries, but also the scope of work that will go on at that level. And using existing frontline staff, we have created locality leadership teams in the 3 localities that we have agreed in Gwynedd. In those locality leadership teams, we've got GPs, nurses, local government social services staff and the voluntary sector. And as a core team, they're able then to spend time together identifying how they can assess and plan and deliver more care closer to home.
Gweithio ardal ydy gweithio o fewn y gymuned a gweithio o fewn y dalgylch iechyd lleol. Felly be da ni'n neud yw siarad a gweithio efo pawb o fewn y gwasanaeth iechyd yn yr ardal fach yma o Dwyfor a cael pawb i weithio fo'i gilydd mewn ffordd sydd yn effeithiol. Ac mae'n gam positif iawn achos yn aml iawn beth sy'n tueddu digwydd yw mae pawb yn gweithio fewn I tîmau bach unigol a does na ddim cyfathrebu yn digwydd rhwng un tîm a tîm arall. Felly drwy cael pawb I weithio fo'i gilydd a cael cysylltiadau yn cael ei codi rhwng gwasanaethau cymdeithasol, rhwng iechyd, rhwng y nyrsys a'r meddygon, mae hynny'n galluogi I ni wella'r gwasanaethau dyn ni gynnig.
There have been lots and lots of challenges that we've all had to overcome. There's no doubt that social services, the community nursing services, medical services all have problems of time management, of actually, although we're very, very clear about what we're trying to achieve and our goals are the same, we come from different disciplines, we come from different value judgments, we speak different languages. And so we've had to spend a great deal of time to develop mutual trust. And it really has been worthwhile. Really what we're trying to do is have a portfolio of responses that are available to service users so that they only have to dial one telephone number to access help, and so that there's a range of options available to them so that they will be able to receive improved care at home, maybe more physiotherapy at home, more social services input at home, generic workers being able to look after some of their social care needs as well as their healthcare needs. And by providing this underpinning and improving patients' confidence in the system, we should be able to reduce unnecessary admissions to hospital and to residential care. This improvement process is all about benefit to service users, and I would hope that they are already seeing changes.
We've developed a locality model in Wrexham which effectively is about professionals across health and social care working very closely together with others such as the voluntary sector and the independent sector within a defined local area, designed to meet the needs of local people within that particular defined area. We've recognised that with the increasing demography, increasing numbers of older people and increasing numbers of people with chronic conditions, that we need to find different ways of meeting the needs of those people in a much more coordinated and joined up way. I think we've already started to see some benefits in the health and well-being of people in the community, patients, clients of social services who are in receipt of the services that we're now providing through locality working. We've seen a reduction in the numbers of people going into residential care, for instance. We've seen